Hello, thank you for joining me today, and thank you to the SCDAA for this opportunity to present. My name is Abby Tainter. I'm the Operations Manager for Sickle, and I'm going to be discussing our advocacy map today. Sickle is a national sickle cell disease advocacy nonprofit that was founded in 2017, and our mission is to elevate the voices of the sickle cell disease community and their stories of resilience. And in highlighting the grave disparities this community faces, we hope to influence decision makers and propel change. We do this through storytelling and advocating for the sickle cell disease community through our programs, the Faces of SCD Storytelling Program and the Ambassadors Program. And through our work, we hope to ignite public interest in making sickle cell a public health concern, to humanize sickle cell disease, which is a relatively invisible disease, inspire the general public to advocate for sickle cell disease, influence policymakers, educators, employers, and healthcare providers to act to improve treatment and care, drive research and drug development to lead to better treatments, and empower the community to share their stories and know that they're not alone. So one of the services that we offer is providing tools and resources to teach advocates how to use data-driven advocacy to enact change. Our advocacy map is an example of one of these tools and is shown on the side here. And the current sickle cell disease data is scattered and incomplete, making it much more difficult for some advocates to find the data that they need. The main source of data is the CDC surveillance program, which is a very limited number of included states, beginning with just 7, dropping down to 3 for a time, and only California and Georgia are still ongoing since 2015. It is currently up to 11 states as of 2019, but that data is still not included or available yet. With that in mind, our objectives for this tool were to 1, build a repository of advocacy resources for the sickle cell disease community, and 2, to centralize and maintain an up-to-date resource of publicly available data on sickle cell disease prevalence in each state. We are hoping to make advocating for sickle cell disease as simple as possible. The first step of this process was a gray literature search. We're just looking for anything that was publicly available and easy to find. It began with checking the state health department websites and conducting a web search for each state. We were searching for prevalency data, namely the number of people in each state with sickle cell disease, the number of newborns each year with sickle cell disease, and the year at which sickle cell disease was added to newborn screenings for each state. The top keywords that we used were the sickle cell disease plus the state, the sickle cell prevalence plus the state, sickle cell incidence plus the state, sickle cell disease plus newborn screening in the state, and then sickle cell disease population in the state. Once we had found everything that we could that was available online, we moved to step 2, which was our follow-up outreach. This included calling the state health departments to request any missing information, and calls were made to multiple branches for each department, including the main contact lines, the hematology and or genetics departments, and the newborn screening departments. Additional communications were also sent to the email addresses and contact forms as they were available, which some states had available for every department, and some were very limited. So we did try to send to as many as we could to try to get as many avenues of information as possible. Once we had completed that for each of the states, we went to step 3, which is the aggregation of data. In this step, we compiled all of that gathered information onto a publicly available map that is located on the Sickle's website. So here's a quick preview of what that looks like on our site. It is called the State Advocacy Resources Map. It does have a search function at the top, so you can type in whatever you're looking for, or you could use the drop-down menu and select your state from there. Additionally, you can just scroll down to the map and locate your state and select it right from there. Once you scroll down with one state selected, it will populate the most current information that we could find for that state. And if you continue scrolling down, we've also linked to many resources that are state specific, including the community-based organizations within that state, the state senator and House representative contact information, and a district finder so that you can locate exactly which representatives you should be advocating to. And then through our efforts, we did find that the information on sickle cell disease across the states is very highly variable. A few states have dedicated pages to sickle cell disease with very clear guidelines for care posted along with other resources. Louisiana was a really great example of this. Louisiana Health Department had a specific sickle cell disease program with contact information listed, they had SCD information brochures, and a standard of care document for providers that were all easily found on their website. And I believe Georgia and California were also other good examples. And then there were many states that didn't have any information regarding sickle cell disease that was publicly available. On these websites, the only mention of sickle cell was that it was included in their newborn screening, as that is federally mandated. And then the basic information is challenging to find for many states. Only 29 states listed the year that they added sickle cell disease to the newborn screening, and only 19 states provided newborn screening data for us. We were able to find at least an estimate of the prevalency numbers for each state using the Novartis 2019 sickle cell disease fact sheet. It does show at least some estimates for each state. And then in conclusion, our Sickle's Advocacy Map is an effective resource for those looking to advocate for sickle cell disease community. And while there's limited prevalence data, the aggregated information at least allows for a snapshot of the prevalence of sickle cell disease in each region. And this enables advocates to have an accurate information if in their advocacy work, equips the advocates with tangible data when working to create policy change. And then Sickle's will continue to update and expand our research and data collection efforts to enhance this advocacy tool and support the efforts of all sickle cell disease advocates. So thank you so much for joining me today. Have a great day.